We've all felt that little buzz, right? The phone in your pocket, that instant urge to check a notification. It's
Hmm.
this almost primal kind of addictive experience. And today, we're diving into how that simple little hit of digital dopamine is being harnessed to tackle some of the world's most stubborn public health problems.
Exactly. We're talking about text messaging interventions or TMIs for health improvement. And what makes this so powerful is just the staggering, unprecedented reach of mobile communication.
It really is staggering.
I mean, think about this. Before mobile phones really took off in the 80s, two-thirds of the entire world had no access to a telephone at all.
Wow.
And now, we have almost 7 billion mobile subscriptions globally.
That level of penetration is just, it's astonishing. The global mobile penetration rate has hit, what, 96%?
That's right.
It means we can reach people in, rural villages, developing nations, places that might not have a clinic nearby, but they absolutely have a mobile phone. That accessibility is the whole foundation here.
And that reach is coupled with this incredible engagement. SMS is almost a guaranteed delivery system. It just bypasses so many traditional public health barriers.
So people are actually reading them.
Oh, absolutely.
Yeah.
The research shows 99% of mobile text messages that are received get opened. And this is the crucial part, 90% are read within 3 minutes.
3 minutes.
Yeah. It's instant, it's cheap, and it's supremely scalable.
And the mechanism itself, that the simple text message, it taps directly into our psychology. The source material we're looking at highlights how it uses our, and I'm quoting here, addiction-like desire to get messages.
That little dopamine release.
Exactly, the reward.
Yeah.
And that psychological hook is a powerful tool for behavior change, as long as you use it correctly.
So our mission today is really rapid synthesis. You've given us a systematic review of reviews. It looked at 15 high-quality published analyses between 2009 and 2014.
Yep.
And this lets us quickly identify where the evidence is strongest, what works reliably, and what major gaps researchers still need to figure out in this constantly evolving field.
Okay, let's unpack this. Let's start with the big wins. Where is this powerful, psychologically tuned tool actually making the biggest, most measurable difference right now?
Well, the overarching finding, across all these diverse studies, is overwhelmingly positive.
Okay.
The majority of TMIs resulted in reliable, positive outcomes across a whole range of health behaviors. Every single meta-analysis that was reviewed confirmed a robust, measurable improvement.
So the question isn't if they work.
Exactly. It's where the evidence is thickest.
So this isn't just a hopeful trend. The data's strong enough to confirm genuine behavioral shifts. So give us the top 5, the gold standard success stories.
Number 1, unequivocally, is diabetes self-management. This area just has the greatest amount of evidence.
Okay.
The review identified 16 unique studies focused on diabetes, and all 16 reported statistically significant positive effects.
All of them. That's incredible.
Every single one. That remarkable consistency, it really suggests that text prompts are fantastic for that daily self-monitoring, the tracking, and the motivation you need for a complex chronic condition.
That's great for managing existing conditions. But what about really entrenched behaviors, things that are hard to change?
Right, so then we move to smoking cessation, which is highly effective. One key meta-analysis on 2 studies found significantly improved quit rates at 6 months. It cited a relative risk of 2.16.
Okay, so a relative risk of 2.16. For you listening, what does that actually mean?
It means that participants who were getting the text messages were more than twice as likely to successfully quit smoking compared to the control group. Overall, it was one of the most successful interventions they looked at.
Twice as likely. That's a great benchmark for impact. So then
Right.
following that, we have interventions focused on lifestyle, on activity.
Yes, physical activity showed tremendous success. That discipline registered one of the highest overall effect sizes reported in the review, D0.509.
And an effect size that measures the magnitude of the difference, right, between the groups.
Exactly. And when you see a number like 0.5, that's considered a medium to large effect in clinical research. It suggests TMIs are genuinely moving the needle for people trying to get more exercise.
And right alongside that, I'd imagine, is weight loss. What did the data show there?
Very strong performance. 11 out of 14 studies reported a measurable reduction in weight. But here's the detail that really stuck out to me.
Go on.
One meta-analysis found that participants receiving SMS messages achieved 7 times greater average weight loss than the people in the non-SMS control group.
7 times.
7-fold. It's a truly startling statistic.
Wow, 7 times greater. That says so much about the power of just consistent, low-barrier support delivered right to you. Okay, and finally, the really critical life-saving adherence interventions.
So the fifth major success area is medication adherence,
Mm.
specifically for antiretroviral therapy, so
Oh.
RT for HIV. The text intervention significantly improved patient adherence. And critically, this translated directly to better biological outcomes, specifically reducing the patient's HIV viral load. It's an intervention that literally saves lives.
But I remember you mentioning that just simple, generic reminders often fail, even for medication. So if TMIs are so successful for art, why did simple reminders for other serious illnesses, like, say, tuberculosis, TB, why did they sometimes fall flat?
That's a really important question about the design. For TB adherence, the results were mixed, and the reviewers pointed directly to the quality of the studies.
Oh, okay.
A lack of rigor in the research designs for those specific trials. But when adherence is critical, like with art, success comes down to how the message is designed. Simple, generic reminders. We tend to just ignore them. We habituate. The key is in the complexity of the delivery.
That leads us perfectly into the next phase then. If the text message is the vehicle, we need to know what adjustments under the hood make it run better. So here's where it gets really interesting. What specific ingredients boost the efficacy and help sustain that change?
The first, and I would argue the most important ingredient, is personalization and tailoring.
Right.
If the message feels like a mass broadcast, it just immediately loses its psychological punch.
Okay.
And we saw overwhelming confirmation of this across the board.
Can you give me a concrete example of how effective that is?
Sure. In the medication adherence studies, positive effects occurred in all of the studies that used tailored or personalized messages.
Every single one.
Every one. Tailoring so, adapting the content or the frequency based on the receiver's specific needs or even their clinical data. It was significantly associated with higher efficacy. It moves the message from just take your meds now to something like, we notice you often struggle on Tuesday evenings. Try setting a new reminder tonight.
It makes the user feel seen, accountable.
Precisely.
That makes perfect sense. But let's dig into the frequency paradox, because this was one of the most surprising findings for me. My gut instinct says you need continuous, daily support to form a new habit. Does daily work best for everything?
The answer is highly context-dependent, which is what's so fascinating. For programs that need constant short-term motivation, like weight loss or physical activity, the data suggested a daily to weekly frequency worked well.
Okay.
5 out of 6 studies that sent at least one SMS a day showed improvements, and that continuous engagement seemed to help people stick with the program.
Mm.
The TMI is kind of like a daily motivational coach.
So daily for short-term goals. But the high-stakes, long-term stuff like RT adherence work differently. Why did less frequent messaging lead to greater success there? That seems counterintuitive.
This is critical, and it connects right back to that psychological reward we mentioned at the start.
The dopamine.
Exactly. For ARTed adherence, larger effects were consistently associated with messages sent less frequently than daily, sometimes only weekly. More was not better. And those highly successful, less frequent interventions often use bidirectionality.
Let's clarify bidirectionality for you listening. What does that two-way communication actually look like?
It means it's not just a broadcast from the health system. The user can reply.
Yeah.
They can confirm they took their meds, maybe rate their mood, or, crucially, send a keyword like HLP if they're struggling.
I see.
That interactivity, combined with tailoring it to their clinical needs, that's what created success.
And this brings us back to that psychological hook.
Yeah.
If you send me a motivational text every single morning for 6 months, I habituate to it. It stops being a reward and becomes background noise.
Precisely. You burn out the effect.
Yeah.
For critical, lifelong adherence, a weekly, high-value, tailored, and interactive check-in prevents that habituation. It maximizes the psychological reward by ensuring the message stays important and impactful. It's a high-value interaction, not a high-volume one.
That is a phenomenal insight for anyone designing these programs. You have to tune the frequency not just to the behavior, but to the risk of psychological burnout. Did the researchers generally use, rigorous academic frameworks when they were designing these studies?
Surprisingly, only a minority of them explicitly reported using a behavior change theory. When they did, social cognitive theory was the most common. So while the effects are strong, they seem tied more to just good human communication principles than, say, a rigid academic blueprint.
The positive news on results is great, but we have to address the structural limitations. You mentioned earlier that the quality of the evidence sometimes lagged. If these interventions are so promising, why aren't the studies more robust? Are we sure this isn't just correlation?
That's the necessary balance, right? While the results are encouraging, the majority of reviews reported only low to moderate quality of evidence overall.
Okay.
The limitations that were frequently mentioned were things like small sample sizes, short intervention durations, most only lasted 3 to 6 months, and most importantly, a lack of rigorous study designs.
And a lack of rigor means they need to do more randomized controlled trials or RCTs, right?
Absolutely. And RCT is the gold standard. You randomly assign participants to the intervention or a control group to reduce bias. The call for more RCTs means researchers need to move beyond simple cohort studies to high-quality trials to really confirm these results.
Especially before governments invest in a widespread rollout.
Exactly. Short-term results are great, but public health needs confidence in long-term efficacy.
And speaking of investment, there's a huge research gap that just stunned me, the financial gap. Texting is cheap, but we have almost no data on the return on investment.
That's right. There is an almost complete lack of research on cost-benefit and cost-effectiveness in the TMI literature so far. This was a critical recommendation across multiple reviews, especially for developing countries where this tech is often the most accessible option.
I mean, if a TMI costs a fraction of a dollar per person and gets 7 times the weight loss,
That is an enormously valuable data point for policymakers that is just missing.
we also need better science design, right? To allow researchers to talk to each other. You called it the standardization gap.
Precisely. Right now, every study measures success differently, so it's hard to compare findings. Researchers are recommending we adopt standardized outcome measures, how you define success, and standardized follow-up periods like 6 months or a year.
So it's more apples to apples.
Exactly. Without standardized metrics, synthesizing all these results is incredibly difficult.
And finally, the population gap. Who is missing from this research that we need to actively seek out?
2 key groups were identified. First, studies on physical activity and weight loss need to intentionally over-recruit male participants. They're significantly underrepresented in the research to date.
Okay.
And second, there's a specific call for more research with adolescents when it comes to RT adherence. That's a uniquely challenging and critical demographic for long-term self-management.
And while all this incredibly strong data is built around SMS, basic texting, technology is changing so rapidly. What's on the horizon?
Well, newer services like WhatsApp, Facebook Messenger, they often surpass the simple functionality of SMS. They allow for multimedia, location sharing, richer group interaction.
Right.
Future research has to pivot, and quickly, to explore the potential consequences, both intended and unintended of, using these emerging tools, especially with younger audiences who might see SMS as, outdated.
Yeah.
It's a moving target.
So what does this all mean? We've seen that text messaging interventions are proven. They're highly effective for several key public health issues: diabetes, smoking, RT adherence, weight management. But the field, it's powerful, but it's still in its adolescence. We have strong evidence for what works, but the field needs more rigor and, less agreement on the most effective delivery characteristics that really maximize long-term impact.
And to leave you with a provocative thought that connects the behavioral science to the technical design,
Mm-hmm.
if we accept that the effectiveness here is tied partly to that dopamine reward of getting an important personalized message,
Mm-hmm.
what is the optimal frequency for long-term success?
It's fascinating, isn't it? Daily works for short-term motivation like weight loss.
Right.
But less frequent weekly messaging works better for critical lifelong adherence like RT.
Which suggests success relies not just on the content, but on timing the message frequency precisely to prevent that burnout, that habituation. Finding that personalized sweet spot, maximizing the psychological impact while minimizing fatigue, that may be the ultimate key factor to explore in designing the next generation of effective personalized TMIs.